People with diabetes have many issues related to inflammation. There's a term called comorbidity, which means diseases and conditions caused by the original disease. Diabetes has numerous comorbidities. Damage to the brain, in fact, increased risk of memory loss, dementia, including Alzheimer's disease and vascular dementia, Parkinson's disease, but also strokes. Damage to the eyes, diabetic retinopathy is rather common in diabetics after the 10-year mark, once they've been diagnosed with diabetes for 10 years. Damage to the back of the eyes, which can reduce your vision. Damage to your nerves. We actually have a separate podcast on nerve damage, nutrients for nerve damage, so we won't go into that over this podcast. Damage to the kidneys, which we will cover, chronic kidney disease, also known as chronic kidney failure. Damage to the heart and arteries, plaque in the arteries, increased risk of heart attack. We'll go into that. So there's numerous things that come out of diabetes. Much of it related to the inflammation that occurs during diabetes. Now, grapeseed is a great supplement for people with diabetes. The pip of the grape is loaded with very powerful antioxidants that reduce cellular inflammation. They really achieve that very strongly. These collectively are known as OPCs, which is oligomeric proanthocyanidins. That's an accepted abbreviation, OPCs. So the PIP is very high in these OPCs, and they're extremely safe. In fact, the first time I heard the term GRAS in relation to a supplement was back at a convention that I was running in the early 1980s. And it was down in Washington, D.C., and a gentleman who was a researcher said, well, Grape Seed Extract has GRAS certification. GRAS means generally recognized as safe for use by the American public, according to the FDA, the American Food and Drug Administration. So the first time I heard GRAS was with Grape Seed Extract. As far as grape skin, we talk about the red grape. That has a little bit of a supplement called resveratrol, wonderful nutrient. And that's also very good for diabetics, by the way. There's a number of nutrients that are great for diabetics. Vitamin C, ubiquinol version of coenzyme Q10, the mineral magnesium, the mineral zinc, vitamin D, certain B vitamins like thiamine. They're unbelievably helpful for diabetics. But the seed of the white grape is loaded with these OPCs. They're extremely beneficial for people with diabetes, which is elevated blood sugar. Pre-diabetes, your sugar is up, but it's not quite as high as somebody with diabetes, so you're almost there. Metabolic syndrome. We'll discuss metabolic syndrome in a minute. So welcome to my podcast, Grape Seed Extract for People with Diabetes. Hi, my name is Jerry Hickey. I'm a licensed pharmacist who also has studied nutrition. I'm over here at Invite Health. I'm also the scientific director, and I'd like to talk to you today about the many good things Grape Seed Extract can help you with if you're a person with diabetes. Please be sure to subscribe to our Invite Health podcast, and please leave us a review. You could follow us on Facebook, Twitter, and Instagram at Invite Health. All of the info on today's episode will be linked in the episode description, and you can visit invitehealth.com/podcast for more information. So let's get going. Now, metabolic syndrome is a health disaster, but it can be helped. And one of the things that helps it is grapeseed extract. It's a cluster of conditions. Elevated blood pressure, perhaps to the level of high blood pressure or beyond. Elevated blood sugar, could be pre-diabetes, could be diabetes. High cholesterol, obesity, that's almost always part of the pattern. Along with that, you'd see elevated triglycerides. That's another kind of greasy fat that can cause a stroke or heart disease. Fatty liver. Grapeseed extract can help a bit with fatty liver, but we discussed that in a separate podcast discussing fatty liver. Plaque developing in the arteries, we'll go into that. Inflammation in the arteries, we'll go into that. uric acid, we're not going into that, but elevated uric acid in somebody with diabetes or metabolic syndrome is very dangerous. It increases the risk of stroke and heart attack. We actually have a separate podcast episode on that also. Kidney disease, chronic kidney disease is common in diabetics. It's also known as chronic kidney failure. Eye issues, cataracts, and diabetic retinopathy. Diabetic retinopathy becomes very common in people who've been diagnosed with diabetes at the 10-year mark. So all of these things can occur in metabolic syndrome. Metabolic syndrome is a disaster. It'll shave years, perhaps decades, off of your health and your life, your lifespan. Countless trips to the doctor, thousands and thousands of dollars spent on prescription drugs. And of course, exercise, a healthy lifestyle, like good eating pattern, all these things help a great deal. So in people with metabolic syndrome or in people with diabetes and prediabetes, grapeseed extract has been shown to help lower blood sugar. That's a very important point. Lower blood pressure and improve blood flow and circulation and the health of your arteries, help reverse plaque deposits, actually, according to a couple of studies. Improve eye health. Lower triglycerides and cholesterol. It does a lot of different things. So let's get to the main point. Let's get to blood sugar, the number one issue with diabetics. Initially, animal studies demonstrated that grapeseed extract does many things for people with diabetes. Diabetes affects the heart, blood vessels, the kidneys, the liver, the eyes, the brain, nerves. That would be a different podcast episode. Grapeseed extract affects blood sugar. It affects blood pressure. It reduces cellular inflammation because of its powerful antioxidant effects. It lowers blood lipids. It's good for kidney health. It's good for your eyes, your blood vessel walls in diabetics. It's a very good protective and beneficial supplement in many ways. Before we go into some of these studies, let's go to a quick break. We'll be right back.
This podcast is brought to you by InviteHealth.com. For over 20 years, Invite Health has provided premium quality supplements and expert advice you can trust. Now, first-time customers can enjoy an exclusive offer. Visit invitehealth.com/podcast or click the link in this episode description. That's invitehealth.com/podcast for your exclusive offer on Invite Health products. Invite Health offers the resources you need to make important decisions about your health. Chat live with degreed healthcare professionals, get product information, and find retail locations near you at invitehealth.com. You can also learn about our new genetic testing program and our exclusive Invite Fitness Wellness program. Follow Invite Health on Facebook, Twitter, and Instagram, and be sure to subscribe to our podcast today. Now back to our episode.
Okay, welcome back. Pharmacist, nutritionist Jerry Hickey here. The number one issue with diabetes, of course, is elevated blood sugar. And that sugar just causes inflammation all over the body. It stiffens all different organs and tissues. It inflames tissues. It's a disaster. So this is the Diabetes and Endocrinology Department at Queen Alexandra Hospital in England. That's down in southern England. It's in the journal Diabetic Medicine. That's one of the journals of the British Diabetic Association. And these are obese patients with diabetes. They're at high risk of heart disease. They're cardiovascular patients. They gave them grapeseed extract, 600 milligrams every day versus placebo. This is a gold standard state-of-the-art study, double-blinded, randomized, placebo-controlled human clinical trial. Grapeseed extract reduced fructosamine within 2 weeks. Fructosamine is a quick measure of blood sugar. Normally, people with diabetes, they prick their fingertip every day and take a little bit of blood and check their sugar in that morning. That gives them some kind of indication of what's going on. Fructosamine is a little better because it gives you a 2-week panoramic view of your average blood sugar. So very quickly, grapeseed was improving blood sugar control. It reduced inflammation in their body. This is a blood test that's very important. We did a separate podcast episode on this. It's called HSCRP. I get it done twice a year because there's heart attacks in my family. HSCRP is a proxy for inflammation in the heart. A normal blood level would be 1. So if it's below 1, you don't have any added risk of having plaque buildup or a heart attack according to inflammation. And let me just explain this. About half of all heart attacks are related to blood fats, like cholesterol and triglycerides. The other half are strongly related to inflammation. So HSCRP, C-reactive protein, CRP. HS means highly sensitive, a very sensitive measure of CRP. You want to see minute differences to judge the amount of inflammation in the heart. HSCRP of 1 or less, you don't have inflammation, it's normal. HSCRP of 2, you are building up plaque, you're going through atherogenesis, but it's not super inflamed. And HSCRP above 3, according to a lot of data, is really dangerous. Not only is the plaque inflamed, it's very vulnerable, it could break off, lead to a clot, a stroke, or a heart attack. So in these patients with diabetes who also had heart inflammation and plaque in the arteries, very quickly, within 2 weeks, grape seed extract lowered their HSCRP from an average of 3.2 down to 2. That's a huge difference very quickly. It reduced their total cholesterol, it reduced their blood sugar, and it improved a very important antioxidant. My friend Dr. Alan Pressman wrote a book, Glutathione, the mother of all antioxidants, and it's true. It's like a very valuable antioxidant in the human body that shields the entire body, and levels in diabetics plummet, and it's not around to protect the brain, the heart, the eyes, liver, the kidneys, etc. So the glutathione levels were coming back. This is a great study, by the way. In a different study, the Journal of Agricultural and Food Chemistry, a great journalist from Oregon State University, they compared a prescription drug, a sugar blocker called acarbose, to grapeseed extract. Very interesting study. Acarbose is given before meals, and it bonds to a family of enzymes called alpha amylase that break down carbohydrates, and you absorb less sugar from the meal. So if you absorb less sugar and you also absorb it more slowly, it's easier for somebody with diabetes or pre-diabetes to control their blood sugar levels. So when they compared grapeseed extract to acarbose, it was actually stronger than acarbose for blocking alpha amylase, and it blocked the second family of sugar digesters called alpha glucosidase. So in all reality here, and this is not the only study showing this, taking a grapeseed extract, 100 milligrams to 300 milligrams, anywhere in between, before a meal with a glass of water is going to reduce your absorption of sugar. Now, it hasn't been studied for weight loss to my knowledge. Obviously, if you absorb less sugar, that's going to help block calorie absorption, and that should help you lose some weight. But they have shown that it helps control blood sugar levels. And it was stronger than a prescription drug acarbose. That's amazing. So Pharmacognosy magazine, this is a small study of healthy men and women. They gave them grapeseed extract at both 100 milligrams or 300 milligrams before a super high carbohydrate breakfast. It was in their test kitchen, where they had a sugary drink, a juice, a fruit juice, and they had 6 pieces of white bread with sugary jelly on it. And when they gave them grapeseed extract between 100 to 300 milligrams, it strongly reduced the absorption of sugar following the high carbohydrate breakfast. Now let's talk about metabolic syndrome, which is that whole cluster of conditions, elevated blood sugar, perhaps diabetes or pre-diabetes, elevated blood pressure, possibly plaque in the arteries, high triglycerides, high cholesterol. You see inflammation, you see fatty liver, you see elevated uric acid, you see obesity in it. This is the University of Alberta up in Canada. It's in the journal Phytotherapy Research. It's a review of 50 human clinical trials. It's a meta-analysis of 50 studies. Grapeseed extract had a significant impact. It improved fasting blood glucose. It improved total cholesterol. It reduced the bad cholesterol, the LDL. It reduced the other greasy fat called triglycerides. And it reduced inflammation in the heart. Okay, this is the first episode, grapeseed extract for people with diabetes. Thank you for tuning into the Invite Health Podcast. You can find all of our episodes for free wherever you listen to podcasts or by visiting invitehealth.com. Please subscribe and leave us a review. You could follow us on Twitter, Instagram, and Facebook at Invite Health. Hope to see you next time on another episode of the Invite Health Podcast. Thank you for listening, And very shortly, I'm going to tape episode 2, Grape Seed Extract for people with diabetes. We'll be looking at eye health, kidney health, blood pressure, circulation, plaque in the arteries. Thank you for listening.